Hello, everybody. Hello, how are you? Hello, and welcome back to our video. I hope all of you are okay and you listen well. We are now making the transmission into site. We make the transmission in our virtual room. Some of the people will be there waiting, and we start there. The people who is in our virtual room, they can talk with me later when I will finish. If they want to ask me some question, I will be free to do that. Okay, and the other people, I will write in the chat in YouTube. And if you want to talk with me, it's just with a message, no more. And okay, we will start our direct webinar. Hello, everybody. How are you? I am Professor De Roca. Most of you know me. If you don't know me, I tell you, I am the director of the M.P.R. International School, International Academy. Sorry, we are an international academy. We teach all around the world. We teach in America, in Europe, and in Asia, in different languages. And also we have this virtual room. This is a web application where the people can participate in our live workshop like this. Every day we do something, shortly, more longer. And the other is YouTube. And there's two ways that then you can follow us and follow our diary. Today is in English. Today we will talk in English about this particular topic, who is TMJs. TMJs is a topic that is interesting, and a lot of people told me, please, Professor De Roca, do more about TMJs. And that's the reason why today I try to do more about TMJs for the people who are in our virtual room and for the people who are in the in YouTube. Topic interesting. That is the relation between. Sometimes we talk about the TMJs talking locally here. Yeah? We will talk in our school, in our academy, about posture, TMJ and posture. How can affect from the top to the bottom, to the bottom to the top. And I think the other important thing is the interdisciplinary treatment. And we go ahead with the webinar. I will put the presentation and then we will start. The role of the TMJ in postural balance. It is important to understand when we do some treatment, because any disease in the body, we cannot treat just the disease. We need to treat the whole concept, the posture of the whole body, the connection. And that is something that we will talk today. All right. The webinar will be to explain the connection between craniofacial system and the posture. You will see the point of view in our academy and some cases. That will be the webinar for today. Pay attention, because TMJs is the TMJ is TMG, temporomandibular disorder. It's very important to understand the global concept, the holistic concept. And then we go ahead with the presentation. Understanding TMJ. The first thing we have to remember always is the anatomy and the common problems of the TMJs. When we're talking about anatomy of the TMJs, TMJs is a particular joint. It's a joint that is prepared to resist compression, traction, but not the compression. When is some compression in this area inside the joint, in this area inside the joint, here start the disease. And the most important area is the retroarticular area that will arrive the whole innervation of the TMJs. This particular area is a special joint, and we have to understand that it's not only here, it's part of the craniofacial system. Remember always that. And how affect the posture? Signs and symptoms of TMJ is related with this issue. As you will see, the TMJs not affect the posture. The craniofacial system dysfunction is affecting the posture. I will show you how. And I will show you our concept in our school, how to treat that particular problem. Symptoms, headache, diseases, back pain, neck pain, clicks, contraction, a lot of symptoms related with the dysfunction of the craniofacial system, and chronically is descending and can affect the food support. And to introducing that, I try to tell you the connection between the craniofacial system and the impacts to the rest of the body. Craniofacial system like this, this is a system, it's not TMJs only. TMJs is little here. You have the teeth, the bones, you had also the muscles. Normally, the position of the jaw is the cause of the disease. Most dangerous position is retroposition. When the retroposition is present, it's making compression in the retroarticular area, and it's starting the bruxisms for defense. We will see later for defense, and it's creating a lot of craniofacial muscle hyperactivities. This retroposition is affecting suboccipitals muscles, cranial muscles, and obviously the stomatognathous system muscles. Slowly, it's going down. It's creating, for the people who is a physiotherapist or an osteopath, the traumatologist to treat the postural problems, when start the dysfunction here, it's slowly making adaptation down. The most common adaptation is scoliosis. It's creating more hyperactivity here. It's creating hyperactivity here. Hyperactivity is creating block. And down is going to the rest of the body. As you will see there, this is the hyoid system here. The connection between upper part of the body and the rest of the body. When starting the changes in the jaw position is creating dangerous into the TMJs and start a very bad defense, bruxisms. That bruxisms chronically is creating muscle hyperactivity, and chronic postural alteration can arrive, imagine, until the foot support, going to the lumbar. Some lumbar problems are connected with this craniofacial system dysfunction, and that is important to understand. When the jaw change position, starts a dangerous, and the central nervous system said this teeth is creating the blockage. And danger here, we have to broken the teeth. Bruxisms. Changes of the jaw position, increase the pressure, alarm signal, bruxisms. Very bad defense. Very bad defense because it's creating more compression chronically, and it's a problem who never stop. That's why I am telling, when you are doing rehabilitation, any rehabilitation, local rehabilitation or body rehabilitation, you have to pay attention to that. This concept is very important. Problem here chronically will arrive to the lumbar, to the foot, from the top to the bottom. Obviously, it is not in one day, but it's arriving. That's why it's very important to make an holistic diagnosis. Okay? That situation, scoliosis, is adaptive scoliosis, related with the oculomotor system problem, related also with the jaw position, related with the occlusion, the foot. All these things chronically will arrive. The same here. Functional scoliosis. Most of the scoliosis, 95%, are this kind of scoliosis. This one, functional scoliosis, as you see in the screen. Just 5% is a real scoliosis. That means anatomic scoliosis. And how we can identify the problem? Obviously, diagnosis is the most important thing. The diagnosis, we diagnosis to plan the treatment. Which diagnosis we promote in our academy? First, postural diagnosis, muscle chain, muscles, posture. We study a lot of tests, different tests, clinical tests, to arrive to a diagnosis. This is not a webinar of posturology, but just to show you the postural diagnosis, clinical diagnosis is very important. But posturology is clinical diagnosis, posturometry. Posturometry, which the posturometer is an instrument who confirm our clinical diagnosis. That's why we do clinical diagnosis and instrumental diagnosis, as you see there, posturometer. Posturometer can show us the problem. Look at here. This is some of the graphics of the posturometer. Look at here, this patient, mouth open, no overload. Do you see here? The patients close the mouth and increasing the load. That is proof that the jaw position can affect the posture. Simple measure. the body center change. And what is the treatment we promote? We promote to annulate. Imagine if you have it to any medical science, have a tool. It's a common tool. Medical doctor, physiotherapist, dentist, osteopath. Imagine to have a tool to annulate, very simple to use, to annulate the negative effect. And this tool is the bed device. The bed device is a thermoplastic device that you can adapt to any patient. Body equilibrium device. And it's annulating the negative effect. And look at that, how it's adapted. Look at that. One size with hot water. Anybody can adapt to any. Obviously, you need a training. You need a training to adapt it, and then you have the mouth annulated, and you can do a good rehabilitation. Look at now. I want to show you just shortly, not too long, because this is a small webinar, the philosophy of the M.P.R, and then I will show you some patients. What is the philosophy of the M.P.R? It's an interdisciplinary method to allow all medical science, all of them, all medical sciences can be there, to work together, to stay in the same protocol, the same language, and work together. Myofunctional postural rehabilitation with the integrated protocol. It is a protocol where all medical sciences speak the same language. What is M.P.R? It is make the connection without interferences with the craniofacial system and the rest of the body. Very simple. It's a diagnostic and therapeutic method. It's just a technique. It's a method to work together. We use tools of a lot of different disciplines, and the purpose is to make in balance the craniofacial system with the rest of the body. The objective found the diagnosis and priority. What we means about priority? About priority, we said about priority, the main disturber that is creating the problem. And from this disturber, this one, you will start the deprogrammation. Integration, neurophysiological integration of the systems. That is our goal. The key. We cannot only specialty work alone. Interdiscipline is good, but you have to speak the same languages between the whole sciences. M.P.R is based in holistic diagnosis, treatment planning, and interdisciplinary treatment. Based in clinical diagnosis, as I told you before, instrumental diagnosis, and diagnosis of complementary tests. We study alimentation, intoxication, different things. With that, we arrive to a global diagnosis to treat our patient. It's based in sensory deprogramming of the systems, postural rebalancing, and sensory reprogramming. That is the concept. The philosophy is very simple. You can understand. Obviously, you need a training not to understand. That is a webinar, not just to inform. And the thing is, when you work with this diagnosis, you see the whole body, not just the T.M.J. And we see some some little treatments, okay? And the bed, the body equilibrium device. Body equilibrium device is a tool. The other tool for reprogramming of the jaw is the reprogrammer. And I will show you different patients treating with reprogramming, rehabilitation, and reprogramming. This patient with the mouse, look at here, and look at there, and then it's bigger that. Bruxisms to defend T.M.Js. And look at here, 4 kilos overload with deprogramming, 0. Measuring is objective. 4, 0. Another patient, the same teeth, creating problem, deprogramming, the same. Patients with the jaw position, here we're treating with the growth. Look at that. A patient who we treat with the philosophy, deprogramming, reprogramming. Look at the growth here. This patient was like this, and slowly we stimulate the growth and we create prevention. And we use also the craniofacial orthopedics, that is a tool that during the growth we create and stimulate. Look at the child in that age, you prevent the future of the patient. That's the goal. Prevention, not treatment. Prevention. If you stimulate the growth, look at here from here the changes. And how it's changing. But that is magic. Beginning and after treatment. Torsion, overload, no torsion. Look at that. That is measuring. First and after the whole treatment. When you start to work in this way, that's a little conclusion. Now that is a little webinar, as you saw, is the view the whole body, not just one part. Integrating therapies. We cannot work alone. Interdisciplinary and holistic concept. Deprogramming system. Rebalancing. And mainly prevention. Start early. That is the goal in our therapy. Prevention. But obviously, if we have an adult, we have also the tools to treat the adult. Thank you so much to be here. If you have any question, be with us. And I just want to show you our web application. Look, I show you here the web application. Let me go. This is our web app where some people is now there in, and this application, you see, you have sessions like this. You see, you have another 2 in different languages. If you are registered here, also you have a lot of videos. If you go here, for example, here, and if you go to free videos, if you register in our application, you have a lot of it. This webinar will be here later, and you can see every time you want. Look at it. You have more than this is fascia, sport, and if you go here and you go and you can see, you can review the videos and also our courses. If you want to formate it with us, we have the courses in the application. You can there go and you can see a lot of courses. Some of them is under payment, some of them a little courses free, workshop free also here. You have a lot. You have posturometry also, posturometry course, masterclass for dentists. You see a lot of courses. This is our web app, just to show you the school, how it works. Okay. Okay, thank you so much. I don't want to disturb anymore. This was it's just half an hour. Yeah, okay. And if you, the people who are here in the virtual room, if you want to make some questions, you push your hand up, and if it's no, we finish the transmission, and also we finish the people who are in the YouTube also. Okay, and remember, every day we do some particular webinars. Don't miss that. In different languages and different topics. Tomorrow will be Spanish, and we were talking about growth. And that will be also a good topic, a good instrument. See you next, and I hope you enjoy our webinar, and I hope I see a lot of you in the next webinar. Bye bye, everybody.